Well, good afternoon. We're sorry that we have you here late on a Friday, but the good news is we think it is worth the wait because we have reached an agreement with respect to creating a new program to serve the population that was previously served by the GAMC program. I'm joined today for this announcement by Senator Berglin, who of course is leader of the relevant committee in the Senate, Representative Erin Murphy, who's been the author of the bill and has been deeply involved in these issues and a really constructive force in the dialogue. Matt Dean, Representative Dean, who has contributed mightily to the ideas and the discussion as well. Of course, the Speaker, Margaret Kelliher, is with us and has been helpful behind the scenes. Representative Huntley from Duluth, who has played such a key leadership role in the House as well. Kurt Zellers, the minority leader of the Senate, Dave Senjem, and of course Cal Ludeman, who has worked so very, very hard on these matters as well. Not up here is Brian LeClaire, who is from my staff and has worked diligently and faithfully on these issues as well. Let me just start by thanking these legislators and leaders who are here today, as well as everyone else who's worked so hard on this for many hours, many days, many weeks, many months, many years to get us to this point. It's a very timely compromise because had this not been realized this afternoon, the process of auto-enrolling the individuals who were on the GAMC program into the Minnesota Care program would have begun over the weekend, and that would have put us on a different path and made it more difficult to get back to a compromise point, although not impossible. Let me just say thank you. A good piece of work, a good compromise, and I think it achieves many important goals. I won't go through it all. I think you have some information in writing, and some of those who are here would like to comment and say more, but a couple of things from my perspective and our administration's perspective regarding this compromise. First, it moves in a very measurable and noticeable way to a concept called coordinated care organizations, or CCOs. This is an idea that we'd like to start paying more for baskets of care rather than just volumes of procedures. It's a very important step, I think, towards the future of healthcare reform more broadly in this program. So this compromise embraces that type of concept. While that is being developed both through legislation and otherwise, there'll be a 2-month period where the GAMC program will exist in a bridge fashion. That's part of the compromise. Then after that, the CCOs will play a substantial role in being the lead organizations for providing service to this population. There'll be a little bit of a premium or increase for 3 of the many hospitals who will be involved because of the overburden that 3 in particular experience, and that would include Hennepin County, Regions, and the University of Minnesota. But many or more will be involved, and there'll be a residual pool for others who are not in the list of 17. There's also a standalone concept relating to the drug benefit, as Senator Berglin has said many times, and Representative Murphy and others, that a substantial portion of this population faces mental health challenges. To properly manage those challenges and health concerns, they need regular and reliable access to prescription medicines, and so having part of this money and compromise be dedicated to meeting that need and serving that need is an important part of the compromise. And so there's a $45 million drug pool, a prescription drug pool, as part of the compromise, and other features. We have a number of elements in it, but it's basically a $164 million impact in the current biennium. Of that, some of it is from the Healthcare Access Fund, and some of it is from the general fund. In the next biennium, the 12 and 13 biennium, it has a $214 million impact, and that is all from the general fund. So those are some of the highlights. I'd like to ask Senator Berglin to next make comments, and then Representative Murphy and Representative Dean and Representative Huntley and others, Speaker, minority leaders, please feel free to jump in, and Cal as well. But hopefully we don't all have to talk. But Senator Berglin, go ahead.
Thank you very much, Governor. I believe the winners in today's agreement are the people who are served by the GAMC program. They will not have to worry about losing coverage or having coverage for only a short period of time. The other winners are the people without children who receive their coverage through the Minnesota Care program, who won't have to worry about having that program go bankrupt and possibly having themselves lose their coverage. I think the governor said that we also, while we understand that this amount of money is a considerable decrease for providers, we have tried to help providers protect people's access to prescription drugs. And I think that's an important component of making the idea of accountable care or coordinated care organizations work, that people will be able to go to a pharmacy and get their prescription filled without a barrier. I think we're going to be interested to watch how it works. We hope that all of the hospitals in the state will participate in the new program. And if we see that we're having problems with that, then I believe in a future time we might need to revisit the issue. I want to thank Erin Murphy. I want to thank Matt Dean for the work they've put into this. I believe that they together helped bring the House of Representatives to a point where it was possible for us to have a continued program.
And Tom Huntley too, Senator, right?
Tom Huntley.
Don't want to forget Tom.
So thank you to everyone else who helped us with this, and I say to the providers, we did the best we could for funding this program, and we're counting on you to continue to be the safety net for the people who need the program.
Thank you, Senator. Representative?
Thank you. Good afternoon. We started 9 months ago in trying to find a solution to the veto of general assistance medical care, and I think we've done a pretty good job at that today. We're banking a lot on reform. We're banking a lot on care coordination to help a population that we know is both sick and poor. They will maintain their coverage, which has been a primary goal for me. And I hope that through the reforms that we're putting in place, they will get better care and they'll be healthier in the end, which has also been a goal for me. I think that our work here today is a demonstration that we can actually achieve our goals when we set our minds to it. And I think that's a good news story for the state of Minnesota and for its people. I mostly want to say thank you to the many Minnesotans who have worked so hard to support this, and especially to those homeless vets who have been here week after week fighting for a health care benefit that's been so important to them. And they were here again this afternoon, and they've made a tremendous impact in this dialogue, and I think they gave us the nudge we needed to get something done. And for that, I'm very grateful. Thank you.
Thanks. Matt?
I'd like to begin by thanking Representative Murphy for her tireless efforts in this. We had a common goal to work as hard as we could to find the very best care for these folks, and to do so in a way that the legislature could agree to and the governor could sign. And I think we started around a common ground idea of coordinated care, and we believe it's nation leading. And Minnesota will once again lead the nation in healthcare reform area, and the work is just beginning. We look forward to it. But I want to thank all the folks on both sides of the aisle who work very, very hard, well as with the hospitals and all the folks out there. Thank you.
Thanks, Matt. Tom?
Well, I'd just briefly like to thank all the people that worked on this, and I would particularly like to thank the homeless vets that showed up, and I would also like to thank the faith community that really put a lot of pressure on us to get this job done. But most of all, I'd like to thank Erin Murphy for the phenomenal work that she did on this for 9 months. It's really rewarding to be a committee chair and have somebody as bright and as talented and hardworking as she was, because she did all the work and I did practically none.
Cal, you want to say anything? Or Speaker, you want to say anything?
Okay.
Cal? No. Speaker?
I think that I just want to say thank you. This is an example of we the people. This is an example of people coming together in coalition for the last 9 months to do something that's much bigger than any one individual person. And we have to think about what we do have today. We will have something called general assistance medical care, basic health care in the state for very poor and very sick people. We will continue to have a Minnesota Care for working people in the state of Minnesota. And we have an agreement that we have some stability for the next number of months, that this is something that is not going to be touched. in the rest of the budget or the next rounds that come forward, whatever they may be. Those are important victories today for the people, for stability in their lives. And I think that's very, very important to remember right now. These people who've been working on this, particularly Commissioner Ludeman, Senator Berglin, Representative Huntley, Representative Dean, and particularly Representative Murphy, are darn near sainthood today. They have put everything into this, and they really deserve our tremendous and deep thanks.
Thanks. With that, we'll take your questions, and operator, if there's questions on the phone, we'll ask that you queue them up in just a moment. I'll just conclude by saying the compromise that's on the table, from my view, accomplishes these things. It maintains coverage for those in need who need coverage. It represents significant cost savings in the current biennium and the next biennium and the ones beyond that if the program stays substantially in this form. And it also represents a very significant step forward in healthcare reform in a direction towards how we provide healthcare from an old way of doing it to a new way of doing it. And as Senator Berglin said, there may have to be some adjustments because this is a new thing, it's a new approach, but I think it is going to reflect the nature of and direction of healthcare reform in many instances, and again, Minnesota will be leading those efforts. So with that, we'll be happy to take your questions.
Governor, how much less expensive will this program be, and will there be some people who will still lose coverage or have much reduced coverage?
Tom, the GAMC program, as you know, is growing very rapidly, and one of the concerns was it was at 30% of biennium, growing nearly exponentially. So the program in the current biennium, had it stayed in its former form, would have cost approximately $750 million. In the upcoming biennium, it would have cost approximately $930 million. And then in the biennium after that, it would have cost well over $1 billion, $1.2 billion or $1.3 billion, just GAMC in its previous form. So this will have very, very dramatic savings from that. But as importantly, it maintains coverage for the people who need it, and it moves towards a different form of providing the service.
So to have that much savings, though, there has to be reduced coverage. I imagine if you're cutting it, is it 3/4 that's being cut, roughly, or?
Well, I gave you the numbers. You can do the math. There, it's on the sheet. But that's what GAMC would have cost in its previous form. In the next three bienniums, $750 currently, then $930, then $1.3.
So just to clarify, Governor, whose ox is getting gored here in terms of who's losing out in terms of money?
Well, Erin, you want to add anything? The amount of funding and the type of care are two different things. We spend a lot of money on care, and the old-fashioned way of doing it, that it was a fee-for-service, blank check, autopilot program. This takes a different approach called CCOs, or Coordinated Care Organizations, and the hope will be this will be a more efficient, comprehensive, and continuous care. One of the challenges we have with the GAMC population is that it's episodic. You have people come and go. They don't have coordinated care. There's not maintenance of care in many cases, and we hope this model will be better with those goals in mind.
We have, looked long and hard at the population served in GAMC, and we know that they are sick, and we know that they're poor, and they get their care in outpatient settings and in hospitals across the state of Minnesota, and they're going to be able to maintain their coverage. And we're going to be asking the providers a lot to transition to a different way of paying for and delivering care, putting more intensity into the coordination of care, to try and meet their needs and improve their health. And we hope that that delivers the two goals of savings to the system, or savings for the providers because they're going to be getting a global payment, and also better health for the population being served. So we're pushing forward with a reform that we believe will work, and we're going to be working closely with the providers to understand where its weaknesses are and where its strengths are, and making modifications going forward to make sure that they're able to do the job we're asking them to do.
Well, I think Senator Berglin wanted to add a comment to that last question.
I think I indicated earlier that the providers are going to see less reimbursement under this new program. But we believe that it will be better, their losses will be less than they would have been if we had virtually the GAMC population losing their coverage and a large number of the Minnesota Care population losing their coverage as well. So we hope that the providers can understand that while this program isn't funded to the level they believe it should be, that we believe that this will help them to be able to continue to serve the GAMC population over the next 15 months.
Governor,
Are you
you,
going to back up of your proposal to cut Minnesota Care? Is that part of this deal?
I'm sorry, Martika, what'd you say?
Backing off of your proposal to cut Minnesota Care?
No, but Senator Berglin, in my discussion with her the other day, made it very clear that we shouldn't be expecting that's going through her committee, or through the Senate at least, and I expect the answer will be the same in the House. So that proposal is still on the table, but it's been rejected by the legislature. Keep in mind, there's also the possibility here that for single adults without children, they may be part of a future Medicaid program that covers single adults without kids up to a certain level. So this may all change again, whether it be Minnesota Care, previously GAMC, now we don't have a name for this yet, CCOs, not WCCO, Eric. But you will maybe see a period 3 years from now or so where this is all going to change again, because we'll have a new Medicaid eligibility for single adults without kids.
Governor, you, Representative Murphy, Representative Huntley alluded to hearing from veterans and other groups, and that helped result in a breakthrough in the program. Would you share those?
Of course, but I need to be fair with this. Veterans coverage is available through the VA for most veterans. So part of the challenge we have is getting folks who are presenting themselves in various other programs, including GAMC, steered to the coverage that they would be otherwise eligible for, whether that be in Minnesota Care, some cases Medicaid, certainly some cases Veterans Assistance or VA medical benefits. So some of that is not a function of eligibility or non-eligibility in VA, it's getting them to the right place. And this proposal, by the way, and I want to credit Matt for this piece of it in particular, puts additional emphasis. If you're going to be a CCO, we hope and expect that you'll do an affirmative, proactive job in identifying the individual's eligibility for other programs. Again, many of the GAMC population are eligible or potentially eligible for other programs. And in the case of veterans, most veterans, if they have served and been honorably discharged, are eligible and are covered robustly under the VA medical benefits.
Is there a chance that these reimbursement rates are going to be so low that the cost of this care is going to be shifted onto other insurance customers, including the people in the private sector? And is there any barrier to prevent that?
Tom, you want us to take it?
Well, that's true. If there's uncompensated care that's given by a provider, they have to do something about that, and the usual way is to raise their rates to everybody else. And part of that will happen with this bill. So who's going to pay? It's going to be the people that already have insurance. Their rates are going to go up because of this, what we're doing here today.
Senator Berglin, with Minnesota Care, there are going to be caps and coverage and dollar amounts, and can you explain the prescription drug plan in more detail in these new programs?
And maybe you'd say a word about the rebate too, if you would, Senator.
Minnesota Care isn't changed under this proposal, so it will go on the way it has in the past. The drug coverage that we will be providing to people throughout the state will be processed through the Department of Human Services. The claims will be processed through the Department of Human Services, and the legislation sets aside a certain amount of the money that we negotiated for that purpose. And one of the reasons that we felt it was important, not only to maintain the coverage, but also because we believe the state, through their rebate agreement and other arrangements they have with the drug manufacturers, are able to get the drugs in most cases at a lot lower cost than hospital organizations can get those drugs. So it allows us to continue to get sources of revenue to help pay for the drugs that otherwise wouldn't be available to hospital organizations in the state.
Senator, what path is this going to, or for any of the legislative leaders, what path will this take to the legislature? And are you going to have committees voting on it, and is it going to be changed, or is there an agreement that goes through as you worked it out today?
Well, I think usually when we reach an agreement, we don't have any substantial changes made in it through the legislative process. We believe in the Senate, we believe we'll be in a position to start hearing the bill next week, even possibly have it on the floor of the Senate next week. And there are people in this building off drafting as we speak to make that happen. So, you know, I'm not standing here guaranteeing everyone in the legislature is going to vote for this package, but I believe we'll have enough votes to make sure it becomes law.
We should see, Tom, we should go to the phone and see if anybody is on there. We'll come back to you. You've already asked one question.
By 116 million.
Does it do what?
Does it grow the deficit by 116?
We have an understanding that there'll be a good faith effort to find the savings for this through reductions in HHS more broadly, and it has a very positive effect on the so-called tails in the out biennium and the one after that. Operator, if you want to see if there's anybody who wants to ask a question on the phone, we'll take those now.
Absolutely. As a reminder, today's conference call is being recorded. If you have an objection, please disconnect. If you'd like to ask a question, please press *1 at this time.
Are you guys going to have any other questions on other topics, or are you done for the day?
We do have a question over the phone.
Martiga, is that you? No? No? Trine, you do? Oh, yeah, go ahead.
Concerning the $10 million of cuts from a fire safety training fund used to train firefighters, why is this something you support cutting, and are you concerned about what it could mean for safety?
If we can, we're here to take the questions on the GAMC program, but we'll come back and answer that question in a minute. Are there any questions on the healthcare issue that we're all standing here talking about? Operator, any other questions?
We have no other questions over the phone.
All right, good. Any other questions on this? Yeah.
Governor, I had a question of you and perhaps of Senator Berglin. Will this make it easier or more difficult when you do the rest of the state budget, specifically health and human services, about the state budget in a broader sense?
Well, it's, from my standpoint, I certainly invite Senator Berglin or others to comment. It spends some healthcare access money, it spends some general fund money, so that's money that, and we don't have, isn't part of an overall budget solution, so it potentially could worsen the budget deficit. However, I believe Senator Berglin and Representative Murphy and others who've said make a good faith effort to find these savings through reductions in other areas. So we're going to take a leap of faith and hope and expect that that happens. Senator?
The legislation that we will be moving forward on will be paid for. So it will not increase the budget deficit. And in fact, I believe that with the agreement that we will not see auto-enrollment move forward, we'll have about $148 million reduction in what the forecast called for in terms of deficit.
Can you talk about what prompted the agreement seemingly so suddenly? It seemed like just a few days ago there seemed to be quite a gulf between the two sides. Can you talk about what?
Well, I think there's been slow and steady progress over the last few days. I remember the meeting I had with the legislative leaders, and in particular, Representative Murphy, well, Matt wasn't in the room at the time, but this idea of then accountable care organizations, now coordinated care organizations, had a lot of interest to me. It was in the bill that the legislature had sent that I vetoed. It was in there as kind of a voluntary or potential pilot project idea. And so we can try to identify things that we both liked rather than things we didn't like, and everybody liked that idea. And so we built on that, the CCO concept, and it's not the only thing in the compromise, but it was a foundation upon the result or the agreement being built. And Matt had this idea of kind of a clearinghouse or a wheel where, as part of the CCO expectation, there'd be an affirmative requirement that organizations who are treating, the previous GAMC population will affirmatively try to get their eligibility determined for VA, for Minnesota Care, for Medicaid, or other services.
Well, hospitals have the option of becoming CCOs, and if they would opt not to, would that population have to go to some other hospital than they might have close at hand?
Lori, it'll be formula driven. There'll be 17 or so that will consume, most of the money or use most of the money because they serve most of the population. And it's formula driven based on historical patterns and levels of treatment. But for those who aren't in the big 17 or so, there's this $20 million of holdback for other hospitals across the state who will get a formula allotment based on previous levels of service.
Governor, comparatively, you seem to take quite a hands-on approach to this compared to some of the other things. Do you see, now that this is out of the way, becoming more personally engaged, perhaps in the
Well, Brian, I mean, I was in some of the meetings and working, on the phone and otherwise with Cal and my team. But in terms of the negotiations over the last few days, Cal and Brian LeClaire from our office did all the negotiations. They were on the phone with me every hour or two or three, but they did the negotiations. I wasn't in the room the last 2 days.
Broadly speaking, do you think this has a contagious atmosphere?
Oh, broadly speaking. Well, I hope so. I mean, you see well-intentioned people trying to do the right thing, wanting to find a result. I think everybody shared the same result. They didn't like our idea of providing the service by moving folks to the Minnesota Care program. We didn't care for their idea of recreating much of the old GAMC with similar eligibility and benefit sets. And so those two things weren't going to work. So we tried to identify things that could work. And Senator Berglin and Representative Murphy and Representative Dean did great work putting ideas, constructive ideas on the table. Cool Cal was in there chipping in and did a great job leading it from our side of the table. So the need was obvious, the goal was mutually agreed upon, people had different ideas about how to get there, we just built on common elements.
We talked a lot about impacts to providers, but what about any potential impacts to consumers? Is there anything really big that somebody can expect when they walk into
Well, one thing from my standpoint, again, is the old GAMC program is people present themselves unexpectedly, usually in need of treatment. The churn in the program was substantial. You had people fading in and fading out of the program. The people in the program in the beginning of the year were dramatically different than the people at the end of the year. And so you had this episodic approach to care. And if you have chronic conditions, if you have conditions that require maintenance, medicine, and treatment, you need continuity of care. So if you're a hospital that's treating these individuals and you know you have only a set amount of money, you have an incentive to try to manage the care other than episodically. It's not going to be perfect, but you have an incentive to try to say, there's a better way to do this than just randomly showing up when you're sick.
Governor, would you agree with the Democrats, some of whom are warning that it would ultimately result in higher insurance premiums as the hospitals that are compensated less?
Well, I would say, compared to what? The two alternatives on the table were moving everybody into Minnesota Care. People didn't like that in large part because it was a $10,000 inpatient cap on hospitalization. And so the organizations were going to eat anything over $10,000, and nobody liked that. Under the program that my friends here from the other side of the aisle presented, they were going to cut provider reimbursement rates by 50%. Many providers really didn't like that. So when you look at this question of, is this ideal, compared to what? Compared to their plan, compared to our plan? That's what we were choosing between, not some idealized notion of what everybody would like in a perfect world.
Governor, how close did the department come to switching and doing the switch?
Well, we're switching this weekend.
Okay, and is it going to still be called General Assistance Medical Care?
Yes.
Well, I don't think we agreed on a name, but I don't know that matters a ton.
Can I just,
Whatever.
name?
Yeah.
Put my provider cap on just for a little bit. When you think about the population served here, we wanted to make sure that there was a connection between healthcare and human services. And that was envisioned in the proposal that we moved through the legislature, and that's envisioned here. We're putting a little more emphasis and responsibility on the healthcare providers, both hospital and outpatient. But we know that this population needs social and human services as well. And so we're going to be asking healthcare providers to connect with human services providers to try and meet the needs of the population, again, to get them as stable as we can, given the amount of money available to us, given the recession, and get them as healthy and on their way as possible. We all agreed, and the area of common ground was it's a population that deserves and needs some intensive coordination to get them into a better place. And if we get them into a better place, that in and of itself is a good goal, but it's also a cost-saving goal. So we have a lot to learn in this experiment that we're launching, but I do think that we've triaged GAMC. We've made sure that the enrollees can get the care that they need, and they can go to a hospital or a clinic across the state of Minnesota. I think that's really important. Their rights are intact. And we will make sure, as we learn from the experiment of the reforms that we've put in place, and build on those and grow on those. But we're on our way. We have work to do in the budget yet, and I think there are some things that we can do to strengthen this proposal as we move through the budget proposal, and that work begins now.
Let me, I just had an answer to the a previous question about does this affect healthy or regular people that are work and have insurance? And the answer is yes, it will affect them. First of all, it will affect their premiums. Second of all, we're underpaying the hospital systems with this plan, and that means they were going to have to lay off employees. Hennepin County Medical Center has already laid off 200 employees. And if you call 911 in Minneapolis, the ambulance takes you to Hennepin County Medical Center. And if there's a 5-hour wait at Hennepin County Medical Center, it doesn't make any difference if you're poor or if you're a millionaire, you have the same wait. If the hospital has closed some of its mental health beds and you're in a mental health crisis, you may sit in the hallway for 3 or 4 days, as they do now, before you get a room to be in. And again, that does not make any difference if you're very, very poor or if you're very, very rich, because the hospital does not discriminate against individuals based on whether they have insurance or don't have insurance, or what their what their wealth status is. They treat everybody the same.
We have time for just one more question.
Governor, when's the last time you were in this?
Agreement next?
The bonding bill spreadsheet's been approved by the working group, that smidge under $1 billion. We have not signed off on that. We'll see what they do next with it. Baird, you got something quick?
Yeah, one last question. When's the last time the two sides here were in a room together to announce a deal, announce an agreement?
Or 2 days ago when we had the press conference on the primary voting bill.
Okay, thanks everybody. Thank you.
Thank you. Thanks, guys.